You have to be ready. I mean, you never know when status will strike. It's typical. It's just like a seizure, but it's prolonged. It could happen in the middle of the night. It could happen in the first part of the morning. You need to be ready. Being prepared is definitely key because that will determine how the first hours go at the hospital.
Status epilepticus is a prolonged seizure. Most seizures will stop on their own after a couple of minutes, almost always less than 5 minutes. If they last longer than that, that's considered status epilepticus. It is defined as multiple seizures occurring back to back without full recovery of consciousness in between. Status epilepticus can occur with any type of seizure.
If the patient works up in the ICU, they'll be surrounded by various equipment. They'll have IV lines in them. They may have oxygen mask on their face. And what you need to explain to them is that these will all use to stop their seizures and to help them stay safe and healthy during the seizure.
During status epilepticus, the brain is having continuous abnormal electrical activity where too many of the brain cells are firing at the same time.
Most people who have status epilepticus don't have any brain damage after the fact. However, once the seizures go on for longer than 30 minutes, there's always a chance that problems can develop. The medication that we use during status epilepticus, we use because we have to. And we don't give medications that we believe will harm the child. Sometimes we can find the cause. Sometimes there's a fever. Sometimes there's some kind of a metabolic problem. But oftentimes we don't find the cause. The truth is that most of the time we can't answer that definitively.
Being an advocate for your child is extremely important. You know your child the best.
If your child is in the hospital with status epilepticus for a prolonged period of time, you need to be taking care of yourself. You need to be eating, you need to be sleeping, you need to be hydrating, you need to get off your feet. You need to sometimes step away from the bedside and let somebody else take care of your child. Seizures can be a medical emergency. Status epilepticus is a medical emergency. To learn more about seizure emergencies and status epilepticus, visit epilepsy.com.